Hello, this is Dr. Grande. Today's question is, what is ADHD, predominantly inattentive presentation? Whenever it comes to attention deficit hyperactivity disorder, ADHD, there's a lot of confusion over the subtypes and specifiers. Predominantly inattentive presentation is a subtype, not a specifier. And subtypes are mutually exclusive and jointly exhaustive. What that means is that if somebody has ADHD, they have to have one subtype, not more than one. That's mutually exclusive, and the subtypes make up all the possible categories of ADHD, jointly exhaustive. So an individual with ADHD would have one and only one of the subtypes. So what I'm talking about here is predominantly inattentive presentation. There are two other subtypes. There's predominantly hyperactive, impulsive presentation, and there's also combined presentation. So taking a look at predominantly inattentive presentation, there are 9 symptom criteria for this subtype of ADHD. 6 of the criteria need to be met for a diagnosis, as well as some other criteria. And if an individual is 17 years of age or older, 5 need to be met. A lot of these symptom criteria are fairly similar. So we start with number 1, fails to pay close attention or makes careless mistakes. We also have trouble sustaining attention. Individual does not seem to listen when spoken to directly. Now it's important with this particular symptom criterion to note the when spoken to correctly part. So it's just not failing to listen. It's not appearing to listen when somebody's directly speaking to an individual. Then we have does not follow through on instructions, trouble organizing tasks or activities, does not like tasks or activities that require sustained mental effort, loses objects that are necessary to complete tasks. For example, paperwork, eyeglasses, a calculator, books, a pen, something like that. Something that's necessary for a task to be completed. Oftentimes we think of this symptom criterion as really only being related to school, but it could be in other areas as well. The last 2 symptom criteria are easily distracted and forgetful. So again, 6 of those need to be met, 5 if an individual is 17 years or older. So we have these symptom criteria for the predominantly inattentive presentation. There are other symptom criteria for the hyperactive impulsive presentation. Now outside of these inattentive symptom criteria, we also have criteria that are for ADHD in general, for the disorder regardless of which subtype. The first one of those is that several symptoms are present prior to the age of 12. So this is interesting when we think about ADHD and the onset, and we think about other mental health disorders and the age of onset. Several symptoms of either the inattentive type or the hyperactive impulsive type need to be met before an individual is at age 12. So if a diagnosis is taking place when somebody's older than 12, there would have to be evidence that several of those symptoms were around prior to the age of 12. The next criterion is that clear evidence of the symptoms interfering with functioning need to be present. So oftentimes ADHD is criticized as a diagnostic classification because it does appear to be overdiagnosed. The DSM here clearly states, though, that the symptoms must interfere with functioning. I think what might happen with ADHD, at least some of the time, is there's a lot of focus on those symptom criteria, and these other criteria, which are just as important, are ignored or overlooked, so that when the symptoms aren't clearly interfering with functioning, the diagnosis is still given, of course incorrectly. The last criterion is that the symptoms aren't better explained by another mental health disorder. So is there anything different about predominantly inattentive presentation, that subtype, as opposed to hyperactive impulsive? Well, we see with the inattentive subtype, it's more prominent in elementary school. whereas the hyperactive subtype is more evident in preschool. Also, females are more likely to present with primarily inattentive features as opposed to males. Now, I mentioned earlier there's 3 subtypes. So the subtype I'm talking about, inattentive, also hyperactive, and combined presentation. So when looking at the inattentive subtype, the full criteria, the symptom criteria, need to be met for predominantly inattentive presentation for more than 6 months, and during those 6 months, the hyperactive criteria would not be met. Symptoms could be there, but the full criteria would not be met. For the hyperactive impulsive presentation, it's the same thing except for the hyperactive impulsive symptom criteria, which of course I didn't cover in this video. And then you have combined presentation, where somebody meets the full criteria for both inattentive and hyperactive impulsive. Again, when talking about ADHD, it's important to recognize that with this diagnosis, one of these subtypes has to be diagnosed. These aren't optional, they're not like specifiers. One of these subtypes is the diagnosis. So it's ADHD, predominantly inattentive presentation. That's the diagnosis. I hope you found this description of ADHD, predominantly inattentive presentation, to be interesting. Thanks for watching.